Hey, Michael, how are you doing today?
I'm pretty good. I'm pretty good. And yourself?
I'm good. So, hey, everybody, real quick, my name is Syah. My pronouns are whatever you feel in the moment. And I'm representing the Center on Colfax, Rainbow Alley today as a part of our month-long mental health expo that is going through all the way to the 31st of October. So stay tuned. Check out all the rest of the interviews and things that we're doing this month. We have a lot of information coming at you. And today we are getting information from our wonderful expert, Michael Chancley, who is going to talk to us a lot about PrEP and sexual health today. So yeah, welcome, Michael. I already asked you how you doing, but how you doing?
I'm great again. I'm great. I'm great.
So let's just jump right in if you don't mind. Start telling me a little bit about kind of what you do and how you started getting involved in the work that you do.
Um, so I've always, even in high school, which was couple of decades ago, I participated in, originally I wanted to go into mass communication. So I ended up working with a job that was funded as a teen pregnancy prevention program through a public access TV show. So that was kind of like my first jump into the world of sexual health. And through some self-discovery and living life and going to school and stopping and starting again, I ended up not going for mass communications, which is what I originally started as. I ended up doing sociology. And while I was finishing up school with sociology, I kind of found myself back in the sexual health world. I was like, okay, I have the summers free. I need to find some volunteer work to do because I'm only taking like part-time classes during the summer. Started volunteering with the agency back home in New Orleans, Louisiana, just working the front desk for a testing program. And that's how I kind of got my feet wet and started learning more and more about what this sexual health world was like. Decided to get my master's in social work afterwards. So I did my internship with the same agency, which led to full-time employment, which everybody loves.
That's all you can hope for.
Right. And so by this time, it was 2014 as I graduated and entered the field. And this was the same year that the CDC released guidelines for how to prescribe PrEP. PrEP, the daily pill that prevents HIV. So I think even though I had some knowledge from volunteering and doing part-time work, kind of getting in as a full-time worker, I was able to come in with a clean slate, didn't have any of the negative impressions on how this would change the field completely. So it's kind of like when the nurse at the job told me, oh, there's this pill that can prevent HIV, where I knew some people had like a lot of reservations about it. I was brand new. So I was like, okay, this is what we're doing. This is what we're doing. I'm all for it.
Like, oh, that's awesome. Let's just go for it.
And it took a while, like as I kind of started navigating incorporating PrEP into my advocacy, because that's just what was important. It was this new groundbreaking thing. I started to learn that it wasn't going to be just as easy as lining everybody up at the front door and giving them a bottle of Truvada and saying we've ended HIV. Like it was, you have a lot of people who have reservations about switching to this new form of prevention. You have a lot of misconceptions. It's a lot. So I'm learning that.
Ooh, Chile.
Yeah.
And trust me, we're gonna get into all of the misconceptions, all of that stigma. I really want to ask you about that. But first, I really want to learn more about, because especially as you were telling your story, it seemed like you kind of entered into the field and then kind of stepped out, kind of was still figuring out what exactly you wanted to do. I was just curious, what keeps drawing you back to sexual health? Why are you so passionate about the work that you do?
And I swear, I think I go through a period. I've been in the field since 2014, and I swear, I think every year I go through a period where it's like, okay, I'm gonna look for something else. I don't want to do this anymore. And then I get some kind of breakthrough professionally or with my advocacy or just with somebody telling me like, oh, I saw you talking about PrEP on social media and I decided to get on PrEP or, and it's just like, okay, Michael, give up. This is where you're stuck. This is where this is what you're good at. This is, you know,
what you were called to do.
Yeah. And I full transparency. I mean, as a Black queer man, I love sex and want people to have the healthiest sex that they can have, both mentally, physically. I'm wanted to actually right before I hopped on a Zoom call, just was having a totally unrelated conversation with a friend, and we just delved into a conversation about just when I think of sexual health, it's so much more than, I feel like a long time I kind of had the impression that it was just preventing and managing disease like STIs, HIV, preventing unintended pregnancies, but it's so much more than that. It's learning about consent. It's learning about pleasure. It's learning to unpack the sexual traumas that we've had in our life. So, you know, I'm learning so much more that as I broaden my scope of advocacy more and more, it seems like every year it's like, okay, I can't just talk about using condoms. I can't just talk about birth control and PrEP. It's, or, you know, making sure you're getting care or treated if you do test positive for HIV or another STI. It's like you have to have those deep conversations. Sometimes people come in for STI screening and then you kind of get thrown into this unofficial like relationship counselor, you know, or, you know, it's like,
because all of those factor into it. Like, how many partners
like,
are you seeing? How many partners is your partner seeing?
Right. It's like, wait, hold on. I'm not officially trained to give like relationship advice. But it's like people get in front of you and they want to unpack. I've had people who you think you are just going to run a quick test on them, get a rapid test, give them their results, and sometimes everything just fully comes out. You learn about you learn about the sexual traumas that people have been through. You learn through the relationship issues that people have gone through. You learn
The
about
gateway has been open.
right? And it's
as someone who as someone who has been a therapist and has done therapy, I totally get that. It's you think they're coming in for one thing and then you open the floodgates and everything just kind of pours out at once. And it's like,
right.
You gave me so much and all I was here to do was give you this prescription.
Right. And so, you know, it's like, okay, you just kind of like I said with my career, I learned you can't fight that. Like, and not to jump like too far ahead, but as a social worker now, I'm enjoying doing the HIV related work right now. At some point, I do want to go into private practice and helping people deal with their sexual trauma on a full-time basis, separate of just like HIV and STIs, though I'm enjoying all of the work that I'm doing around HIV and STIs now. But that is long-term goal because I am learning that you can't just stop there when you discuss people's sexual health.
Absolutely. And honestly, Michael, that work is so needed. And as I'm listening to everything that you've talked about so far, it takes me back to my own high school and middle school experience and like those sex ed classes or the health classes where everything, and also speaking from your experience of, you know, being this gay Black man, I feel like a lot of my things are very heteronormative. So yeah, birth control and how not to get a woman pregnant, but we're not really going to talk about what same-sex sexual health looks like, or the things or precautions you need to be thinking about, or even with the heteronormative issues that come up in classes, that's still pretty limited because they want you to behave and act in a certain way. So we don't talk about consent. We don't talk about boundaries.
And it's very interesting that you say that because I'm learning, and I think this is one of the reasons that I'm such a big advocate for PrEP now is I think a lot of work around HIV prevention, you know, in the US, it definitely heavily impacts queer men and transgender individuals. Yet we take this very, I don't know if I want to say heteronormative approach, but I feel like a lot of the values around sexual health, and don't get me wrong, it's a very progressive feel. Like, it's so great that you have so many people who are both a part and allies to the LGBT community who are coming together to fight for our well-being. But I do feel like sometimes when your sexuality is looked at through the lens of disease prevention, that becomes stigmatizing in itself. So I even in my 30s, I'm learning so much about how to talk about sexuality in the absence of disease prevention and management. I do have to talk about that 40 hours a week, but it's like, I even start thinking like, we have to be able to have these conversations that don't prioritize or center the transmission of a virus or a bacteria, because that in itself becomes traumatizing. You start to see yourself as, you don't see sex as something that's pleasurable. You see yourself as this vessel for passing or preventing the passing of disease, So definitely I had to, separate from my work, learn that for myself, like learn to enjoy sex, learn to embrace sex and everything that comes with that,
That's awesome. So I could talk to you about kind of the theology behind everything all day, but I do want to dive into kind of more specifics about PrEP, because that's what we're here to talk about.
Right.
Let's break it down. Let's clear it up for the people. What is PrEP and how does it work?
PrEP is the use of a daily pill that prevents HIV. A lot of people I still hear who have misconceptions and think that it is something new or experimental, which is not true. Studies have gone, there are still studies to improve how we use PrEP and disseminate PrEP, but studies for PrEP started over 10 years ago. The medications used for PrEP have been around even longer than that. They are currently Truvada and Descovy, which are antiretrovirals used to treat HIV for individuals living with HIV. So again, it's nothing experimental. It's a medication that people living with HIV have been taking for a very long time. And now we know after numerous studies that if you are HIV negative and you take this medication, it can actually prevent you from acquiring HIV as well. So if you see any propaganda or scare tactics online, it's nothing new. It's nothing experimental. It's not something we don't know how it works with the human body. This is something proven to be very effective at preventing HIV with minimal to no side effects.
And you say that it's an everyday pill, so that means you need to take it every single day.
So that's a sticky conversation as well. If we, because we do use, like, CDC guidelines are kind of like the Bible to the work that we do. But we also know that CDC has to get information and draft all of these guidelines, and there is a lags where sometimes those guidelines fall behind science. So the standard is, yes, you do want to take this medication every day to prevent HIV, but studies have shown that because I do get a lot of people who are like, well, I'm not that sexually active. If I'm only having sex a few times a year, or if I'm going on vacation or a trip, and I'm not generally having casual sex, I don't need PrEP, or to take it 365 days a year. There is a method. Some people know it as 211. Some people know it as on demand, and studies have proven it to be very effective, which is if you anticipate a possible exposure to HIV, you take a double dosage of the medication 2 to 24 hours before the possible exposure. And then 24 hours after you take that first double dose, you take a single dose, and then 24 hours after that, you take another single dose. So you've actually effectively prevented the acquisition of HIV through 4 single, well, a double dose and 2 more single doses, so through 4 pills. And that is a method that I try to educate more people on. Because I don't want anybody turned away because they feel like being able to take PrEP 365 days a year is a barrier for them.
No, yeah, thank you so much for clearing that up, because that was something that I've talked to some people about, and that was a very confusing topic. Is like, do you need to take this every day? What if I'm not having sex? So no, thank you for clearing that up. When you think about those misconceptions that you mentioned earlier, I know you mentioned like one misconception around PrEP is the idea that it's something new, when it's something that actually has been worked on, experimented on, with a lot of research behind. What other big misconceptions do you feel the public has when they think about PrEP?
That can be a totally separate panel on its own.
What would you say is the biggest misconception?
I would say right now, if anybody is social media savvy, I know there are a lot of misleading ads that talk about the side effects of Truvada and how it impacts kidney and liver functioning. Right, yeah, so I actually get a lot of questions about that, so it's almost kind of like you have to be able to like spit out this pitch when people ask those questions about that, because we do see it a lot, and I want to be honest, but also not like buy into all of these misconceptions. So one of the things is there are a lot of ads about class action lawsuits that are saying that Truvada it's causing kidney failure, which is simply not true. If you follow the guidelines and are actually getting it prescribed by a physician, we do know that in very few individuals, Truvada can impact kidney functioning if you are not monitoring kidney functioning while you are on PrEP. So one thing is, any provider should be getting labs to look at that. Make sure that everything is you have healthy kidneys to start off with. Also, they should be monitoring that on each follow-up appointment. If you are the small percentage of individuals who it does impact kidney functioning, we would definitely be able to tell before it did any significant damage. And once you stop taking the medication, basically it kind of reverses itself. So the only way it would really have a significant impact on someone's kidney functioning is if they are taking it unprescribed without the proper medical labs that you should be getting. But when I hear these people like, oh, I hear everybody saying that it starts to make your kidneys fail, it's like, no, it doesn't.
It could be this one person who just absolutely had a whole bunch of other stuff going on, and now
right,
it could be anything.
Right. So I think sometimes we have to think about the source of this information.
Check the source. Always check the source.
Right. I mean, I've been on PrEP for over 5 years now. I'm actually going to drop into the lab to go get my labs done right after we leave here, so that I can get another.
You better model.
So that my provider can go ahead and send me that little message that says, after 5 years, your kidney functioning is just fine while on PrEP.
That is so awesome. No, thank you so much for providing that counter narrative, because that would freak me out too if I'm like, wait, what? Kidney failure?
Right.
And
if you are one of those individuals who do fall into like that small percentage of where Truvada doesn't agree with your kidney functioning, now we have another option, which is Descovy.
Oh, so that's kind of the difference between. Well,
right,
there might be some more differences in between, but
right. And I'm still currently on Truvada. I'm one of those people. If it's not broke, don't fix it.
Period.
So my provider, she still continues to prescribe Truvada for me. Truvada has continued to work for me. So I haven't seen a personal need to switch yet. And those are, like I said, don't just it's going to be funny because I feel like the social media is a good way to disseminate information about PrEP. But at the end of the day, make sure you're having those discussions with your providers as well. Don't take, sometimes you have to take information with a grain of salt.
Until you get to the people that actually have the knowledge and information.
Right. Just like I said, even with like the on-demand PrEP, I feel like CDC usually is very conservative with their guidelines. So CDC would not be releasing guidelines and pushing PrEP and funding opportunities to get PrEP in our communities if it was out here causing mass kidney functioning.
And now that's just the critical thinking piece.
Right.
That people seem to struggle with sometimes.
Right.
I want to switch gear. Oh, go ahead.
Go ahead.
Oh yeah, I was just gonna switch gears a little bit and start getting into a little bit of the stigma. I read through your article, Racism, Queerphobia, and Respectability Politics in PrEP Advocacy. And I think for me, as someone who doesn't use PrEP, I haven't had a need to. I'm kind of detached from the stigma around it and the conversations people are having, especially in our communities around PrEP. And I just wanted you to speak. I was wondering if you could speak a little bit to what you wrote in your article around the stigma of PrEP.
And definitely that article is on Medium. You can Google the title and it should come up, or go to my LinkedIn page. It's on there. There was a certain artist who I won't name on this on this interview who had some very misinformed, negative things to say about PrEP and how it impacts people and how it impacts their sexual practices. I feel like some of that was, there was some homophobia in how it was presented as well. Some shame around the types of sex that we like to have. So I was one of those people. I was like, this is just one of those flyby stories. Another artist is going to say something similar and everybody's going to cancel them, and then we'll move on to the next thing. We do that I feel like everything has like this 24, 48 hour cycle of outrage. But I just saw the conversation on social media just going further and further and further and further left. And I think after maybe like 5 days, oddly enough, I was actually homesick that day when I decided to hop on Medium and type that up. And I was like working even on my sick day, bringing awareness. I just feel like a lot of times we judge the types of sex that people like to have, and we sometimes forget why people like to have sex. So even to go back to the misconceptions that you talk about, I've heard a lot of people say, oh, people only get on PrEP because they want to have condomless sex. And it's like, okay, so that is a decision between them, their medical provider, who is going to help them make the best health decision that they can, and the sexual partners that they have. It's like we should not withhold medically accurate information from people or withhold access to PrEP just because we have our own reservations about people engaging in condomless sex, engaging in casual sex, engaging in lots of sex with multiple partners. Again, those are things I think we have to remove judgment on and kind
start minding our business.
Right, and really shift focus on, is the goal to control the type of sex that people have, or help them have the healthiest sex they can have when they are having it. Because we can remove PrEP from the equation and we can deliver a box of condoms to everybody's house. But if that person decides that they are not going to use a condom, even one time, I think sometimes we say, we want to have consistent condom usage, but as one of my mentors always says, I'm going to paraphrase, you don't get a little bit of HIV at a time. You get it one time. So we have these behavioral interventions. We shame people into using condoms. And this isn't me advocating for or not for using condoms at all. That I feel like that's a personal decision.
It sounds more so that you're advocating for people's right to choose.
Right.
How they protect their bodies.
Right. And if your choice in that moment is to not use a condom, PrEP is a good tool. With PrEP also comes with regular STI screenings and treatment. So not only do you have this pill that prevents HIV, but you have guidelines that most physicians should be following, and I believe do follow, that will make sure that you're getting regular STI screenings, because we know not everybody does that. So not only are you getting a tool that will prevent HIV, but you're also getting guidelines that are going to make sure that you are being tested frequently for STIs, and you're going to get treatment should you acquire an STI. And I think one of the things that we learned from PrEP is that once you become more comfortable with it and start shedding the layers of your own shame and stigma, you start having those conversations with your partners. I have had partners who I let them know, I preface it, hey, I have my last STI screening was in August. I have had condomless sex since then. So I want us to both know that we have a risk of one of us transmitting an STI to each other if we decide that we are going to have condomless sex in between STI screenings. And I want us to be informed about that. And I want us to be on the same page about that, because I hate the phrase, somebody gave me something. No, two consenting adults decided to engage in a certain behavior and a certain health outcome.
Where you knew that the risks were there.
Right.
Talk about it. I love that. No, I appreciate you for just being a role model in that way, and showing how it doesn't have to be an awkward conversation or something that's super taboo. It can be something that actually strengthens a relationship and makes better sex. So
people get so shocked because of the field that I work in that I can be like, it's so
really,
I've had sex with people, casual sex, and it's like, oh my God, I'm sitting here like treating this person like a client. I'm talking about safe sex with them and like challenging sex. Well, like,
oh my goodness, you just can't get away. You need an extra check.
Right. Like, I forgot, like, it's almost like, wait, I'm still like pretending I'm at work. Like, can we just take our clothes off and do this? And I'd stop talking about the work that I do for a second. But I'm so glad that's actually helped people who are living with HIV disclose their status to me, because I'm so open and transparent. Individuals who may not know their status would ask me questions about getting tested or getting on PrEP. So if I can do a little education while enjoying my own sex life, go for it, you know?
And something that you mentioned earlier, and I think this will be kind of the last thing we talk about, but I wanted to make sure we definitely hit on this important intersectionality topic, is you mentioned kind of your identity as being Black and gay. And I was curious about, when you especially run PrEP or just sexual health in general, how do you think our community is kind of disproportionately impacted or restricted in access to things like PrEP or just sexual health in general?
I can't speak for everywhere. I can definitely say that because there's another part to that too. In addition to being Black and gay, I am also in the South.
Period.
Right.
So I got you.
I can't speak for Black gay men on the West Coast or the East Coast, but I can definitely speak for Black gay men in the South. We know that there is a lot of medical mistrust because of historic things that have impacted the Black community when it comes to sexual health or health in general. We know that there are a lot of things that impact you being gay with, even as we talk about the mismanagement of COVID right now, we know there was a lot of mismanagement for the first decade of the HIV pandemic. So being gay, it's like you have this level of distrust around how we approach sexual health. Being Black, you have this level of mistrust with how we talk about health in general. So I realized that as another Black gay person walks into my office, they're carrying like that on each shoulder. So I have to break down the misconceptions that this is not something experimental. This is not something that is going to ruin your kidney functioning. This is not something that we are trying to force on you. If you walk out of this door, and I always tell people, I am not a salesman. So if you feel like not being on PrEP is the best option for you, I'm going to talk about other sexual health options for you as well. And then being from the South, I feel like we look at the South and the rates are highest for HIV and STIs in the South, yet we have a lot of shame and stigma about talking about sex in general, and we know we have sex. Right. So to like kind of when I go to, I mean, right now we're doing virtual panels, but whenever I do an in-person panel or participate in a group discussion and the room is full of other Black gay men, and you're trying to challenge the misconceptions and the stigma and the shame, because everybody who's on PrEP, according to many people, they are just sluts and they don't know how to protect themselves. And it's like, no, being on PrEP is protecting yourself. And you can add other tools to that, such as condoms, such as getting tested regularly. So just to kind of see that we know Black gay men are most impacted by the HIV epidemic right now in the US. We know those rates are concentrated in the South. So I have to remember that every time a Black gay man walks into my office, or even in a casual setting. I've been out at the bar and somehow the conversation around PrEP comes up. I've been in like campaigns and on posters and stuff. So I remember sitting at the bar talking to someone, and the condom bucket where you can like get free condoms at the bar, my picture is on it. So it's like you look so familiar. Oh wait, that's you. So, so you know, definitely being able to understand, like be able to understand what people are walking in to my office on their back as they come in to discuss PrEP with me, and being able to unpack that, you know.
Mm-hmm. Yes, and I'm also curious of if you've noticed any trends or concerns around gender expansive folks, our trans folks, or non-binary folks, and if there's any particular struggles that you notice in those communities.
One of the questions that often comes up, and I'm not a medical provider, I try to give the best information I can, but also let people know that make sure you have the discussions with your medical provider. A lot of people do, whether they're either on HRT or thinking of starting hormones, they are apprehensive because, you know, that becomes that's another challenge in their life separate from sexual health. So a lot of people have the question like, will my hormones stop working, or will the hormones prevent PrEP from working properly? So I think that's where it's important to make sure when you are deciding to get on PrEP, find out, is your provider knowledgeable about trans health issues and knowledgeable about sexual health? Because those are conversations you want to know how it's going to interact with other medications that you're on. I think sometimes, well, not sometimes, often, because of it wasn't very long ago that we use this umbrella term for gay men and trans women in sexual health called MSM, men who have sex with men. But trans women are not men. You can't lump them in. Their issues, their concerns are very different. So that has led to a lot of trans women are afraid to sometimes come into HIV/AIDS service organizations and talk about their sexual health. So I have to realize, I have to be ready to answer these questions. I have to be ready to unpack my own, still after several years in my field, I have to be able to unpack my own biases around trans issues, make sure I'm staying educated outside of just how HIV is transmitted. Be willing to apologize if I say the wrong thing or say something offensive, and not put the burden on them educating me, making sure I go and educate myself so I don't make that same mistake the next time a trans or gender non-conforming individual walks into my office to talk about PrEP. Because the last thing I would want is for me perpetuating some kind of stigma or misinformation that they decide that, well, I'm just not going to get PrEP from there. So.
Yeah, and that's another closed door to them. So no, I appreciate you advocating for doing your own homework and modeling that.
Right.
So I wanted to kind of start getting into some closing thoughts around what would you say is throughout your sexual health journey, what would you say is one of the biggest lessons you've learned about yourself?
That I'm human, that I would definitely say, I don't know if this is PG-13 R-rated, but so I'll keep it somewhere in the middle. As someone who again has my own traumas that I've had to unpack around sexuality, prior to PrEP, I had a lot of trying to find the right word. I around before getting on PrEP at 30 years old, engaging in penetrative sex was something that created a lot of apprehension for me, where I didn't get to enjoy it the way I enjoyed it, because I'm like, I have to worry about, is someone going to remove the condom, or is the condom going to break, or or just like, even if I'm gay, oh my God, I forgot to use a condom that time. Like, and back then I remember when the test had like a 6-month window period. So if you had an exposure, you walked around anxious for 6 months waiting to see how, if your results were going to come back negative. So now to kind of have that alleviated, I have found myself learning more about what I enjoy sexually, because I'm not walking into a intimate sexual situation fearing that I'm going to walk away from that situation with HIV. Now it's like I'm getting to focus on it, like what kind of foreplay I like, what kind of positions I like, and I remember just not being able to do that. And I think when I've done a few campaigns. I've done some stuff where I post on social media about PrEP, and I start to learn, like, if you can tell people that you are doing this to prevent HIV on such a large platform, there's nothing you should be ashamed about your sex life. So even learning like
Period.
what kinks and fetishes I like, and being able to talk to partners about that, like, I'm into this. Are you into it or not? We can do it. You got to shoot your shot and throw it out there to see. And stuff that I probably would not have been comfortable enough in my sexuality to talk about several years ago.
No, thank you so much for sharing that. I think, yeah, it sounds like a different level of freedom.
Right. So definitely want to give a quick plug. If anybody is interested in finding out more about PrEP, I have, for the last several years, I have been a part of a group on Facebook called PrEP Facts, Rethinking HIV Prevention and Sexuality. So if you are, and now I am the current administrator of that group. So it's an open forum. The group is private, but we right now have over 20,000 people worldwide in the group. So I don't know how much privacy that allows at this point. But it is a safe space that is moderated to make sure that we are judgment-free, that we are sticking to medically accurate information and facts. We talk about everything from how PrEP works to how to discuss PrEP with your partners and your provider, misconceptions. We actually have a lot of professionals who use it as a tool to stay most up-to-date about what's going on in the world of PrEP. So definitely you can find me commenting and moderating and posting in the PrEP Facts group on Facebook.
Awesome. Thank you so much for sharing that resource. Y'all better go check it out. And also, thank you so much for watching this interview and this video as a part of our month-long Health Expo going all the way through October 31st. If you want to learn more and find more interviews, you can totally go to our website, lgbtqcolorado.org. There's a little Health Expo marker at the top of the website. You just click on that. It takes you to where you need to be, and you can see everything that's popping off this month. So get educated, stay informed. And Michael, do you have any final thoughts?
You are an amazing host. You made me feel totally comfortable. So thank you for that. I totally enjoyed the experience. So
awesome. No, I had a good time with you. This was fun and I learned so much. So I really, really appreciate you for just, being open, being vulnerable, being willing to talk about things that are super personal to you. I feel like it just made this super powerful and informative. So no, thank you for the work that you do every single day, including on your off days.
Right. Thank you. Yeah, today's my last day of vacation today. So
see, look, I'm tired of you.
I was like, I have to get back. I have to get back to Atlanta. I visited home. I was like, I have to get back to Atlanta and return my rental car so I could get back to my apartment and set up my camera and be ready to go at 1:00. So.
Period. Well, I appreciate you for making the time on your vacation. Period.
Anytime, anything in the name of PrEP. So.
All right. Thank you so much, Michael. And we will see y'all next time in the next video.
Thank you. I appreciate it.